Excellent. Excellent. Great. Well, it gives me great pleasure to introduce Kate Holliday, who is an advanced practice nurse in rare and genetic conditions, patient experience, researcher, and community engagement expert. Her education includes a Bachelor of Nursing degree, a graduate diploma in nutrition, a Master's in health promotion, a Master's in health science. She's worked in the health sector for more than 20 years. In 2020, Kate was listed on the 100 Outstanding Women Nurse and Midwife Leaders by Women in the Global Health and World Health Organization and partners, and in 2022 became an alumni in the prestigious Australian Health Ministers Award for Nursing Trailblazers. Her clinic work has focused on community-based triage and health system navigation, and she's worked as a nurse in Australia and the USA. Kate developed and tested a model of community-based nursing care in rare and genetic conditions that in 2019 was expanded into a pilot program across 10 disease areas where specialist nurses are trained to sit within patient organisation and health foundations. This is the Pathways program, and Scleroderma Australia have been part of this service since 2023 with their own specialist Pathways nurse. Kate has been a leader in community engagement in research, service and policy design at Cancer Council, the Kinghorn Cancer Centre in 2012, started the Centre for Community-Driven Research, which is a non-profit organisation dedicated to engaging patients and their families in the decisions that are made about research and healthcare. Kate has significant experience working with government, industry, non-for-profit organisations, as well as research and international organisations, including working in Geneva, Switzerland, with the Gavi Alliance and the Australian Department of Foreign Affairs and Trade, and the Health and Human Rights portfolio. She's also worked in leadership roles, including Head of Research at Cancer Council New South Wales, Australia, and Head of Policy and Strategy at the Kinghorn Cancer Centre. Kate's also served on a board director as a board director at Health Technology Assessment International, and is a member of the WHO Global Alliance for Care of the Injured plus Basic Emergency Care Working Group. And it gives me great pleasure to welcome Kate today. All right, Kate, you want to start?
Is that over to me?
Yes, it is. Now, can we get your presentation up? What if there we go, perfect.
Okay, we good to go?
Fantastic. Thank you, Kate.
Great. Thanks for having me today. I always giggle a little bit when we're on group meetings on Zoom or platforms like this, and it reminds me, I don't know if anyone remembers Romper Room from when you're little and you're looking around the room, and Miss Helena used to say, oh, I can see this person and that person, and I always have a little giggle when we're on these platforms. So I'm Kate, and the chief nurse in Pathways, and we have a few different clinics that we run, and for Scleroderma Australia, I'm your Pathways specialist nurse. At the moment, we're also recruiting for another specialist nurse so that you can have two of this, and some more choice in the times that we're available to help you out as well. So what I'm going to do today is talk a little bit about the program and the service so that you know where it's come from and what to expect from the service. We will have time for questions, but I'm a bit cheeky like this in that I like to ask the questions of you, because we do our nursing degrees and specialization, and we do master's degrees and all of those things when we're working clinically. But actually the most that we learn is from patients, and every patient that comes through the clinic, I learn something more and I note it down. And I do that so that we can pass it on to other patients. Any tips and tricks and what's worked for one patient might work for another. And that's especially in rare disease, how we have to work. We have to work like that, and we have to work together and learn from each other. So the history of Pathways. So it started with me in about 2012, 2013. And so what happens when you're a nurse is that your friends, your family, your colleagues, they send people to you. They're like, I've got this friend who's got X, Y, and Z. Could you just have a chat to them? And that happens quite a lot when you're a nurse. And it was happening to me quite a lot, particularly in my other professional positions. So I would have patients coming and I thought, actually, no, we need a system around this, because I know this happens a lot, and we need to formalise how we provide care to patients when they're coming to you either by phone or by video, whatever it might be. So I developed a protocol around that concept of, if a patient comes, how can we best help them and make sure they're getting holistic care? So I developed that in different types of rare disease, and then we had the fortune of meeting with Health Minister Greg Hunt at the time, who saw the value in this process and could see that this hadn't really been done before in a systematic way. So we were able to then do a pilot across 10 different disease areas to test that protocol that had been built. So that went from 2019 to 2022, and we had over 3,000 people with rare disease come through the clinic. So it's been tested really, really well. We started with one protocol, and by the end, we'd been able to consolidate that and really be sure that what we were doing was on the right track. And one of the words that you'll often hear in Pathways is holistic. So when you come into a consultation with a Pathways nurse, you're going to get holistic care. It's not just about what's happening physically, but we talk about what's happening emotionally, maybe with other family members, everything that makes you a person. So from that pilot that I spoke about, what it resulted in is that we have guidelines. So every nurse that works in Pathways has to follow guidelines and protocols. And then we have a really stringent training process for the nurses. It's actually not easy, and I'm pretty hard taskmaster with the nurses and making sure that they're ready for clinical practice before they actually go out and look after patients. And then for the nurses themselves, we support them with training and with peer support for them, and looking at their work as they go to make sure that they're confident and competent in their work. And some of the things that we've been able to demonstrate is by having some central infrastructure. So our organisation runs the program and then trains up the nurses for other organisations. We see a lot of cost savings, because it means every organisation doesn't have to have a chief nurse and someone to run the training and all the evaluation and all the infrastructure that goes behind it. So it makes it quite affordable for patients to be able to implement a Pathways specialist nurse. And then we're also able to look at the time required. So we're able to plan resources a lot better. So in that pilot, we saw that the nurses were spending overall about an hour and a half with the patients, and then with follow-up as well. In the past 12 months, we've done a lot of outreach into regional and rural areas to make sure that people in those settings know about the service, and we've seen a really strong increase in uptake from regional and remote Australia. So what we have is, a lot of you will know about helplines. So helplines are where, a bit like Cancer Council, where you call up, you can get some information, but you don't have a clinical assessment. Then on the other end is formal case management. So this is often through things like disability services, NDIS, mental health services, where one case manager will have a finite number of patients that they're looking after and stick with them for many, many years. Where Pathways sits is that we do a comprehensive primary consultation, and our job is to help patients access services and understand what's available to them, even in low resource settings. So a lot of those rural and regional patients that come in, there might not be as much available to them, but helping them access what they can locally, and then if they have to go into metro areas, helping them to coordinate those kind of services. So we're not trying to create that dependent relationship that you have in formal case management, but rather empower patients to understand the health system and ask the questions that they need of their clinicians. So we've had, as it was noted, we've had some awareness and recognition of the service through different mechanisms, and that's just really important for us, and it's not just me, it's the whole team behind the program that have led to these awards and recognition. And it's just hoping to give people confidence that this has been something that's gone through a really strong process to get to the point where it is now. And it's something we're really proud of as well. So some of the other specialist clinics, so we work with CMT Australia, and we have Ehlers-Danlos and Genetic Alliance Australia and Genetic Support Network Victoria, Syndromes Without a Name, and Inherited Cancers. So those are our rare and genetic clinics. We also have some central clinics that we run, and they sometimes integrate with the rare and genetic clinics as well, depending on what patients need. So one is looking at when someone's discharged from hospital or emergency setting, in an emergency department, making sure they've got the discharge plan and then reintegrate into community health. Urgent care planning, so this is often, particularly with people with very, very rare disease and genetic conditions, if they need urgent care plans. So someone that has hypos quite often, or maybe seizures, making sure they have their urgent care plans in place. Post-trauma, so a lot of people go through life and have trauma, whether it's a physical trauma or violence, it might be a motor vehicle accident. Lots of things cause people trauma. So this is a special clinic for people that need a trauma-aware approach to care. And we have special access, rural access, people living in rural and remote Australia to help them coordinate their care and services. A diagnostic pathway service for people trying to find a diagnosis. They might have been going for years on tests, and we try and help them work with their clinicians to get a diagnosis to rule things in or out. And then complex conditions, so people with multiple conditions that are trying to manage a lot of things all together. So I spoke a little bit mentioned the training that nurses go through. So to be a pathway specialist nurse, you need at least 10 years experience. Now this is really important because what Pathways offers, you've got two parts of Pathways. One is the disease, the condition itself. So a really good understanding and insights around the condition that you're working in. That's one part. Probably the bigger part, I would say, is understanding of the health system, and then putting those two parts together to help people access services. So it's not even just about navigating, it's about actually accessing services. So, you know, everyone around the group today will have experienced challenges in the health system. So things like wait lists for the public system. And we're working through these things with patients all the time. Do we go on a wait list where it's a lot more affordable in the public system, or is it something more urgent where we need to get in to the private system, but that's going to have a lot more out-of-pocket expense? But these are the kind of discussions that we sometimes have to have, is triaging and deciding what's important for the patient in front of us, but together as a team and thinking about what we need to do. The nurses then go through the protocol training, so the Pathways protocol training, and then they have to do their own research project and presentation. So whatever condition area that they're working in, they go away and do a small research project, and this demonstrates to us that they understand the condition area and can present it. And part of that too, and I'll have the slide in a minute, is about making sure that every bit of information that is given to a patient is evidence-based. We then do the condition-specific training, and we use a lot of case studies to do that. So real-life transcripts of patients with the condition. And these are big transcripts. They're usually around 15 pages long, going through everything that's important to patients in the particular area. And then the nurse uses those as practice and case studies of what they would do for that patient. The next step for them is that they observe consultations with a more experienced nurse to just get a feel for the process of Pathways and how consultations run. And then they'll have their own consultations, which I supervise and make sure that they're safe in their practice and doing a good job. Then after that, once they're in their role, there's ongoing monitoring and evaluation and training and support that I spoke about before. So as you can see, this is where a lot of the cost savings come in for organisations. That, you know, this is a lot of human resource, a lot of time that goes into training a nurse and having the support structure and infrastructure available so that nurses can work in this kind of setting. So as I was talking about, when nurses are working in Pathways, they have to make sure that all the information that we're giving is evidence-based. So this is part of their training as well when they're doing their presentations, is making sure that they're getting information from really credible sources. So not just off websites, but actually looking at the research or the medical journals that information comes from. And, you know, sometimes even, you know, it's in my own practice, I'll look at a website, and a lot of the time websites or information sheets won't have references of where their information comes from. So sometimes we're chasing back that information just to make sure it's accurate, because we know a lot of the time, you know, a challenge, and we're a charity as well, is keeping information up to date is a challenge. So we're always on the ball behind the scenes with that to make sure that any information that we're giving is most up to date. Okay, so what can you expect in a consultation? So first of all, you can expect professionalism from the nurse that you're having an appointment with. You can expect kindness and compassion, and you can expect that nurse to have knowledge of your condition and knowledge of the health system. Sometimes you're going to need some tough love, and that's something that we do with compassion, but sometimes it's hard conversations that we need to have with each other when we're in a clinical context. So you might get some tough love from time to time. And I'm the youngest of 6 kids, and I've got 3 big brothers, so I've had a lifetime of having to give tough love. So in a consultation, what you can expect is that it's your time to talk about your experience so far. Now, we do have that protocol that I've been talking about, and nurses have to follow that. But the way that they do that is up to them, and everyone's going to do it a bit differently. So in a consultation with me, I'll usually start by saying, you know, this is your time, and I'll get you to just talk about everything that you've experienced so far, from go right back to the beginning, right back to diagnosis, and we talk through that to see where you've come from and what your current experience is and what you need help with. So while you're talking, the nurse will be sitting there calmly, but behind the scenes, they're taking notes and they're taking everything that you say and doing a little assessment as they go. They're following that protocol. So you might be talking about X, Y, and Z, and that's great. You've got your time to talk, and everything you're saying, they're thinking behind the scenes. Is this something I need to have an action for? Is there a gap in care? Is there something we need to do? So it might seem very calm, and it might seem like you're talking a lot, but behind the scenes, there's a lot going through that nurse's mind in terms of what we need to cover within a consultation. So you'll have time to talk, and then if there's anything that you've missed in your own description of your condition and where you need and what you're looking for help with, then the nurse will ask some questions, maybe to fill in some of the gaps if we haven't covered it already. And I do encourage nurses to take that kind of process more than a question and answer back and forth, which can be actually a bit tiring. let the patient talk about things in their own terms and then add the questions afterwards. But usually, we cover most things off with that first discussion to get an understanding of where people are at. The nurses that are Pathways nurses, we work in primary and community-based care. So we work a lot with the Australian Primary Care Nurses Association. And this is just another way to show of what nurses are doing while you're talking about your experience. We're always thinking of the different things that we need to do to make sure that we're covering off our protocol and make sure that we're offering that holistic care. Okay, now to access the service, there's a few different ways you can do that. There's an online registration form, and at one point or another, you'll be asked to fill that in because it's a pre-consultation form. So it's just like if you go to a GP or to a new specialist, you'll always have to fill out a bit of information about yourself and your condition, so that the clinician, the nurse at the other end, knows a little bit about you before you have that appointment. So you can go directly online and fill out an online registration. That's fine, and that comes through to us, and we triage it through to the appropriate nurse. You can call. There's a 1300 number that you can call, and that will go to a receptionist where you can leave your name, number, and email, and then we get back to you that way. Or you can just email directly. Whichever way you go, we'll always send you back to that pre-admission form, just because we always need to have that information on file as well. The pre-admission form, it's pretty quick to fill out. There's two purposes for it. One is it actually helps you reflect on your needs. So it goes through some of the things around what parts of your body are affected, which with scleroderma is incredibly important to know how you're affected. But it also then helps the nurse prepare and make the best of both of your time in that consultation. So if when you're filling in your pre-admission form, you've got a space where you can talk about, what you want to get out of the consultation, the appointment, any questions you might have, and gives the nurse time in advance if they might need to do a little bit of research for you. And we talk about making the best use of your time, because we know everyone's busy, and we know that particularly with scleroderma, people have a lot of appointments. So we don't want to be taking 2 hours of your time to go through, all the online registration form and then taking up your time with that. So if we get that first, we can do our research, and then the nurses are actually instructed, you can take as much time as you want in the appointment, and if you need a second one, that's okay. But we're always aware that everyone has busy lives, and we don't want to be taking up too much of your time if we don't need to. The appointments themselves, they're on Zoom. You can use Zoom by phone or computer. It's just a couple of clicks. You don't need to download anything. It's really easy. Zoom or these kind of platforms that we're using today, they're really good for people with hearing difficulties in particular, because we can use lip reading more, which helps with people who have hearing difficulties. And it can be difficult at both ends on the phone to hear. It can be difficult for the nurse to hear if it's by phone or only. So all in all, you can do a better assessment and a better outcome when you can actually see the person in front of you and also have that connection as well. So far in the service, we've seen some trends come through in the kinds of requests that the patients tend to come to us with. So the most common one is to be able to connect with services and clinicians that understand scleroderma. So there are a couple of ways that we do this. We keep a register as we go of, as a patient comes in, we ask them about who they've seen already and which clinicians have been good to work with and understand the condition. But we also then do a lot of work if, just say you need a physiotherapist. If there's not one in your area that we know understands scleroderma, we'll do a call around for you to see if there is one that we can recommend as a referral. The next best thing, because that's not always going to happen, there's not always going to be a service or clinician that understands scleroderma. So after that, we then look for health professionals and services that are willing to learn. Who can we work with to upskill, to help them understand scleroderma so that they can support patients better? And this is a part of the service that then becomes part of capacity building within the health system and for the particular area that we're working with. So in scleroderma, then we're building more clinicians that potentially understand the condition and are supported in understanding the condition. So it's not just patients that we're supporting, we're also trying to support our colleagues, the other health professionals out there to upskill and understand different conditions at the same time. Another request that comes through is wanting to connect with another person of a similar age and stage for peer support. So someone that they can have a chat to, particularly if they're newly diagnosed or have a decision that they're needing to make about, treatment, just to, not to, get clinical advice, but just to understand what other people have gone through and how other people have made decisions about their care as well. Another thing people want to know is if they're missing anything in their care or in the access of services. And there are probably basically two different types of patients that come through. There's patients that actually have a really great care team, a really great access to allied health. And when we go through it, sometimes what I'm saying to them is actually, no, you're absolutely where you need to be. There's nothing missing. You're doing a great job. I don't think there's anything we need to add to your care team. So some people are just wanting that reassurance, and that's absolutely fine. We're just checking off that all bases are covered and you're not missing anything. On the other side is people that might be just starting out, or they might have been in the system for a long time and just not been able to quite get that care team together. Might be because they're in a regional area, or it might just be bad luck that they've not been able to access the services that they need to. So there we're building the care team around their needs and helping them integrate with the health system that way. The other thing that often comes up is how to interact with clinicians. So what can you ask for? So a lot of the time we're giving people prompt questions. So you can ask your clinician X, Y, and Z. And sometimes the trick that the nurse is doing with the patient is just getting the language around it, because sometimes it's just about phrasing a question a little bit differently to get a reaction or a different outcome with a clinician. So making sure that all the pertinent information is being collected for whichever clinician you're working with, so you can ask the questions you need to. But also empowering people to know, yeah, it's okay. You can ask questions of your clinicians. That's what they're there for, and not to shy away from that at all. So in a nurse-led, so Pathways is a nurse-led clinic. It's all nurses, run by nurses, and under nurse supervision. The beauty of this is that we have flexibility. So when we're seeing patients, if we see trends, we can come together as our nursing team and with patients. I'm going to do this in a minute, and think about how can we solve some of the problems that patients are coming to us with. Can we do a little project? Can we do a little pilot to make things a little bit better for patients? And that way we're moving patient care forward all the time. So this is an example, not something that we've done, but in general nurse-led clinics, that's what they're really, really good for, being a bit more reactive. So what I'd like to do now is a little bit of an interactive session with you, just to get some ideas. I'm going to stop sharing my screen so that I can see you, if I can. Okay, there we go. That's better. Hi. All right, I need to bring my questions back up. Okay, so what I'd like to do is, so I was just talking about how we can solve some problems together that, that we have when patients come through. We want to make life better, make the process of care a little bit better. So with those 4 top requests that come through the clinic quite often, I'd like to get people's feedback and maybe take some steps forward to solving that. So as an example, one of the things that comes through quite often is, how do I manage symptoms and how do I discuss that with my clinician? So one of the things we're working on in the background is is there a checklist, particularly for Raynaud's, that patients can fill out, a bit of a tool of what their symptoms are, what they've tried, what's worked, what hasn't, and then that becomes a one-pager, for example, that you take to your rheumatologist or pain management specialist, whoever you're working with, so that they get a really clear picture of what you've tried already, what's working, and where you need to go to be able to manage any pain or any symptoms. That's an example of something we're doing in the background. So the first question I have for you is around access to clinicians, access to services. So what has your experience been with allied health and clinicians understanding scleroderma? And when you come across somebody that does understand your condition, what is the impact? What difference does that make to your care?
Rowena's raised her hand, Kate.
Yep. So is everyone on mic? Can everyone interact? Is that? Yep.
Yep.
Go ahead, Rowena. Hi.
Hi, Kate. Yeah, look, I have some really good allied health workers. I see a hand therapist, an OT, a physiotherapist, massage therapist, gastroenterologist. And they all understand the disease, which is absolutely fantastic. And it just helps them understand, like when they see me on the day, and if I'm not feeling really good, they know. And, you know, I don't have any sort of judgment. But the only challenge I have at the moment is I've changed GPs, and the GP I have has no idea of scleroderma and isn't showing any interest in really understanding what it is about. So that's something that is really important to me, of course, in my care now and future. And I was hoping, you know, if you may know of any clinicians, GPs that do have that understanding and that I can connect with.
Yeah, so in a consultation, what we would do in this case is I would have a look around at what patients have already come through. Maybe there's a GP that another patient has used that we can refer you through to. Because we work in other rare diseases as well, sometimes it's about, as you know, there might not be a GP that understands scleroderma specifically, but getting a supportive GP that's willing to learn. That's the second approach. So that's the second line that we would look at. And if we strike out on both of those, then we do a little call around to the GPs in your local area and say, got a patient with scleroderma, do you have anyone with experience, or is someone that we could work with just to educate a little bit for this patient? So that's the kind of effort that the nurses go to behind the scenes to make sure that any referrals that we're giving you are good ones. We don't, and you know, things like OT, physio are classic examples, because quite often what happens is the first stage is, it might be through NDS or it might be through your GP plan, is you get a referral to a physio, for example, but sometimes it's just the first one that, you know, is on the list. It might be a sports physio. It might not be someone that's really understanding of this condition. So we want to make sure that you're getting a good referral, because we know people are going to be more adherent to treatment as well and management if they're getting cared for. So that's the kind of thing we go through in a consultation to have a look at.
Okay, great, thanks.
Tara?
Yes, I I think it's really interesting what the idea of still connecting with you guys, even though you feel that you've got your team sorted, but still, what else have I missed? The power of that when I'm thinking with Rowena, you've got a great team, except the missing spot. Think of the people that could benefit from knowing you've got this great team around, and that flow-on effect. It just excites me thinking as a community to promote the service also for those people that think that they don't need it, but the benefit could be broader than the individual. I think it's really a very powerful message that we as an organisation, in our own community to celebrate and talk about. I think it's really quite valuable.
Yeah, so, you know, as we go along, and we've seen this in other rare disease areas as well. As we go along, we're building this, it's almost like an ecosystem for the condition area. So an ecosystem for scleroderma where we start to see who in Australia has knowledge, who has expertise at all levels, not just your specialists, because we tend to know who are the good specialist centres, you know, in hospital systems. But in the community, that's like a bit hit and miss. So we start to build this ecosystem where we can refer patients through, and every patient that comes through, every person that comes through, we're learning from. We're asking them, you know, who have you seen, who's been really helpful, and building that repository. And it's something we'd like to do with this community as well. We've done with others. And, you know, another area we're working in, Ehlers-Danlos, we sent out a survey to the community to say, who have you seen, who's been aware of the condition, would you go back? And it's confidential, we don't publish that. But getting patient recommendation. So we got 100 patients giving their feedback, and that gave us an automatic network. So anytime a patient with EDS comes in now, we just look up, okay, you've got this GP near you, you've got your physio, and people are really doing a lot better. So it's exactly that. I get a bit excited about this kind of stuff. It's not just helping the person in front. It's just building this absolutely beautiful ecosystem where every patient the next patient coming through is going to be better off because of the contribution of the person before them. Okay, Janelle.
Hi, Kate. A couple of things. I go to a scleroderma clinic, but it's an hour away. But that's fine because there's some doctors listed, say rheumatologists in my town, that say they do scleroderma, but they actually have bugger all knowledge of it.
Mm-hmm.
Never found an orthopaedic surgeon that understands scleroderma, which is one of the hard ones.
Yeah.
I'm on NDIS and I've had a lot of OTs and physios. Never had one that's ever understood it. But what I do at my first meeting is I always give them a scleroderma book.
Good.
And I ask them to read it and then come back and see me, not just chat straight away, because I think they've got no idea what you're talking about. And they always say, thank you, can I keep it? And they refer back to it. The other thing about a checklist is when I go to the scleroderma clinic, the Australian Interest Group, Scleroderma Interest Group, they send out a thing once a year for you to fill out, which could be condensed, like I think it's about 20 pages, but it could be quite condensed because my rheumatologist flicks through the pages and she might just look at, you know, your bowels, just, you know, swallowing different things, and they look at the score at the end, but you could quite easily condense it, and I think a checklist is important.
Yeah, for sure. So look, one of the there's lots we can do in an appointment, and we don't do everything because it would be too much. We always look what's most important for the patient at that wherever they are in their care. But one of the really important things, because we know, particularly with specialist appointments, where you get your 7.5 minutes.
5.
If you're lucky, on a good day.
$500 for 5 minutes, just about.
Yeah, pick the wrong job. So making the most of that time with your specialist is something that we'll often work on with patients as well, because we know that time's condensed and it's limited. So helping patients drive the conversation a little bit more, particularly, you know, with neurologists, for example, you know, they've got their checklist of things they need to go through and check off. And a lot of the time, you know, we hear reports of patients going into a specialist appointment and seeing this, not the face-to-face contact. So helping patients prepare for important specialist appointments or appointments is something that we'll talk about. And like I said earlier, it's the skill of a nurse sometimes is also knowing how to cut through, knowing
the
what,
red tape sometimes.
yeah, and cut through of like, this is, if you say this, that's going to pick someone's ears up. So helping patients with that, but also, and yeah, condensing things into,
Yeah, instead of having a big story, you know, I fell over and I
yeah,
tripped and I did this, you
yeah.
know, but you
And
say
we'd
this,
love it.
whatever.
We'd love it if you could do that. We'd love it if the health system worked that way. But we're working on different strains. So helping patients make the best out of those situations. And
I find surgeons are the hardest ones, you know, neurosurgeons, those sort of things. Rheumatologists, most of them should understand. But it's when you go to dentists, those ones, they're the hardest.
Yeah.
And
Yeah.
if
Look,
they've dealt with someone.
the health system and the way that health professionals are trained, particularly specialists. You know, if you're a cardiac specialist, you're interested in about this much of a person. So we're trying to look, so in our clinic, we're looking at holistic care, so that, you know, putting those pieces together. Really disjointed health system in terms of health professionals talking to each other. So depending on the patient in front of us too, we might, if it's particularly complex care that people are going through, we'll develop like a short summary of your care plan so that it's something you can take from clinician
not
to
4
clinician.
pages.
Yeah, and another thing, we're just starting to work on a little bit with the Cambridge Rare Disease Network in the UK, is that they've developed a passport, a rare disease passport, that you can take with you, and particularly if you're in, like I work a bit in urgent care as well, particularly in urgent care where you need to be able to communicate very quickly what's happening with you. What we're talking to them about is that the passport that they've developed, the patient fills out themselves and puts the information in. What we're talking about is, well, what if you added a nurse in there to make sure that everything that is needed is in there as well? So we're just having those conversations at the moment.
Yeah, like you get your plan, you know, your health summary off your GP, like mine's 5 pages, and I got to take half of that off, but they always say, could you take half that off?
Yeah.
Well, no, it's got to be put in there because that's what you've had, you know, but you don't always need to show everybody that.
Yeah, that's true.
So it needs a system like that. Thanks.
Yeah. Chris. I just can't hear, just need to
Chris,
pop
turn
on the
your microphone on.
There we go.
How's that? Better?
Super duper.
Particularly when you say, do you understand scleroderma? And they go, yes, but they don't. So then you've got to go through the process of going to them again and going, what can you ask that you know that they've got a proper balanced idea, particularly dentists. They say, yeah, I've heard of it. And you go, okay. And then you think, right, I'm right there. But it means they've heard of it.
Yeah.
They've read about it, you know, back in school or something, and then when you go back the next time, they forget. So they go, well, you know, you're eating too much sugar and you're doing this and stuff like that. And you go, I've got scleroderma. And they go, oh, right. So it's wasting our time because you wait for a month to see a dentist. Then you get there and they go, yes. And then you think, yes. So then you make another one. That's another month down the track. And then you eventually get, you know what I mean? And then it's maybe 3 months and then you're going to have to start all over again. So if we could have, I mean, I'm renowned now for having my big book when I go to all my specialists, and they now smile and laugh and go, oh, good, she's here again. And but they've come on side. First of all, like they found it confronting. So you don't know how much your clinician's education is. So yes, they can say, yes, it's scleroderma. Yes, I know about that. But then do they really? And how do you find out? So
one tip is, so often, going to an appointment and say, do you know about scleroderma? Yeah, I've heard of it. Okay, so that's a bit of a flag. It's like, okay, you've heard of it, you don't know about it. A better question, a good question to ask is, have you treated someone else with scleroderma?
Excellent. Yeah.
That will give you more insight into whether this person in front of you knows about the condition, because whatever training we've done as health professionals, whether a doctor, a physio, whatever, books tell us something, but we learn mostly by practice. That's how we consolidate any of our learning. So yeah, if you say, have you had a patient with scleroderma before? That'll tell you probably more than you need to know. So in rare and genetic conditions, we know not it's an impossible goal to educate every clinician on every rare genetic condition, but we know that. So what we want to do, and what this process and and Pathways is developed and designed to do too, is help. Patients are going to have to be educators. It's part of the deal in rare and genetic conditions. So we want to help you in that process. So we want to help you in, you unfortunately have a role of being an educator as well. So how can we help you the best way? So and some of the things that I've spoken about are ways that we try and support that. So, and we do it case by case too, to understand, if you do have a clinician or health service provider that's been a bit tricky to break through, we can have a chat about, what might be able to be done. We don't always jump to switching to second opinions and switching clinicians. If you've got a care team in place, we'll first try and, unless it's absolutely impossible, first try and work with that, because we don't want disruption, and we know that the second you change, there's going to be a wait list. So we want to work with what you've got first. We don't just jump straight off and go, oh, you need someone else. So really trying to work with health professionals to empower them as well to be, more understanding of the condition. The thing we found is when we've done sort of a summary with a patient on their care team and what's going on, GPs have loved it. They have absolutely. We get such strong feedback from GPs in particular about, man, it's a godsend being able to just really see very, very clearly who this person is as a whole.
So, Kate, if you were going to a new clinician and you had that summary, can you take it to them and say, this is a quick summary? That would be really good.
Yeah. So in a consultation, we go through everything you've been, and we, sometimes you have to be a bit selective of what you put in there.
Mm-hmm.
Can't put everything in there. And then on any information that we send through, we always will have a little note at the bottom saying to the clinician, saying if you need help understanding scleroderma, come. We're happy to help you out.
Beautiful. Wonderful. Thank you.
You're welcome. Okay. This is a bit of a follow-up question. When you get to a clinician that understands scleroderma and you feel supported, how does that help does it help in your motivation in maintaining your health and in adhering to treatment? What has your experience been with that? Tara.
I speak about this a lot, the difference between having because I've had both experiences. I've come from a team that's been very well integrated, with my rheumatologist being the lead of that team, to a context where the expectation was the GP was the lead of the team, and I had to generate the multidisciplinary team required for my management moving forward. So I first of all connected to my rheumatologist, who then suggested a GP that they knew, who knew scleroderma, and then I had to get that GP and then go out from there. So I've had both experiences, and I know the difference for myself, the trust and ease of approach when recommendations came to me, when I had a team that I trusted. It was no-brainer. And the team that I have to build myself, you just have to tread a little bit more carefully and just know a little bit more. And fortunately, because I've got a good understanding of the disease and myself in the, how it works, I can do that, but it's a lot harder.
Yeah, for sure. Okay. No one else? All right. Okay. Next question. Yeah. Oh, yeah.
And I was just going to say, Kate, that having knowledge is power, which we know. So when we have all that knowledge, especially if you've had the condition for 20 years, 30 years, as opposed to say a brand new 12 months, 2 years, big difference.
Yeah.
And the depending on where you are and who you're dealing with, like the gaslighting that you can get from any of your specialists and a GP or allied health can be really hard for you to get over when you go to see a new one, or you've got to build out a team, and it puts you behind the 8 ball. So, and I know that we talk about it a lot, that you've got to be your best advocate, and you have to, but technically it shouldn't be up to us, but it is, and it's beautiful that we've got you guys there to back us up and be able to give us that knowledge to be able to step up. And we all know we've been to see great physicians or clinicians and walked out and went, oh, what a relief, because you do work yourself up a bit sometimes. But that relief when you have someone that completely understands you and genuinely gets all your little things that maybe you were thinking it's in my head, but it's not. It's actually a physical thing. So, and then walking out the other way where you go, well, I've just wasted $500 and I walked out and they've made me actually feel 20 times worse than I was when I walked in. So,
but that's the kicker when it costs you $500 to feel that way, isn't it? Look, specialist fees. They're just they're pretty eye-watering. Even if it's a gap fee, it can be eye-watering for sure. So that's why and those are some of the things we're thinking about too. Is cost. It's got to be a consideration, and that's also we want to get you to good specialists, even if it takes a bit longer sometimes, because we don't want you wasting that $200, $300, $400, $500. But one of the things, the next thing we wanted to ask around is, we're getting more and more people wanting to connect one-on-one peer support, and there's pros and cons and challenges around that in how it's done. But I just wanted to get a sense of from the community and experience of, particularly if you're a seasoned professional in terms of you've been through the system, you've had a lot of experiences that could probably maybe help someone, particularly people newly diagnosed. One of the, in the research that we do, it's around patient experience and experience in the health system. And we ask patients a lot of questions, but probably the best question we ask is, what do you wish you knew? What do you wish you knew at the start? And that's a really good question for people who have gone through the system to share with people that are newly diagnosed. My question to everyone is, if there was a system where particularly newly diagnosed people or even people that have gone through the system but might be coming up to a decision that they have to make and just want to bounce things off another patient, how would you feel about that, and how would you feel comfortable in having a process where you could be connected? Janelle?
Just one quick question. Do you ever suggest support groups?
Yep. So absolutely.
And that's where they would have got involved. That's where they could connect with someone as a one-on-one.
Yeah.
If they want.
Yep. So part of care planning is if is referral through to a support group. We always go back to the literature. What we always see is where peer support can fall down, or if it isn't successful, it's when people are connecting with somebody that either isn't their, not even their age, but just a similar situation, or we're humans. We need to be able to connect with people that in our
Still around,
peer.
which is,
Yeah, so a lot of when patients are coming through, what they're asking for is, somebody that is in my age group, but more importantly, the same kind of same stage of condition, because we've had this in the literature as well. If somebody with a mild case of a condition is paired with someone with a really severe, that can be disastrous. That's not a good. So getting that mix has been really important.
do you ever follow up? You probably don't have the time to follow up to see whether they actually do follow through with what you suggest. Like if you do suggest they go to a support group, but they don't connect with them because maybe they don't know how, or they don't have the confidence.
So we'll always, whenever we give a referral, we always add the how. So if it's a specialist, you go to your GP, you get a referral, you move on. If it's support group, you register here, you blah blah blah. So we're always that's the difference that I was trying to explain earlier around. It's not just navigation, like it's not just saying here's X, Y, and Z. It's here's X, Y, and Z, and this is how you access it. So then we do the initial consultation, do the follow up, and hopefully then we can send people on their way. But we'll always put a note in just to check in. How'd you get on with this? Or if I know someone's got an important appointment coming up, I'll put a note to check in and see how that went, if there's any follow up that's needed. Yeah. Rowena.
Oh, hi, Kate. Yeah, I was diagnosed 2 years ago, and sometimes I go online I think there's a Scleroderma Foundation support online group, which has been absolutely a godsend, because being newly diagnosed, I don't know where everyone else is, it's really scary because symptoms come up and you don't know what it is. You don't know if it should be taken lightly, or you should actually go to the hospital. And then, anxiety increases, and then you're very paranoid. So just to have that support there is invaluable. But I'm not sure if there's anything else. I know I haven't been to any of the support groups, but I'm planning to go to my local one.
Yeah, but with peer support, it's not for everyone. Like there's some people that absolutely love it, and others that it just doesn't mix with them, and that's absolutely fine. The main thing we know about success in peer-to-peer support is, like I said before, that it's your actual peers. So just because someone has the same condition as you doesn't make them your peer necessarily. So there's the other conditions that we work in. We do a lot of this connecting people, and it's opt-in. Like you're never sharing. Like I'm never sharing, Joe blogs. I'm not giving their information away without their permission. It's a case of opting in. So a patient might say, if anyone ever wants to reach out to me, you can give them my information, or otherwise, if we don't know anyone, sometimes we'll put a call out. Is there anyone out there around this age group, this stage, that would be willing to talk to this new patient? Not sharing names until there's consent and it's opt-in. It's not, we have to look after everyone's privacy. We're not just publishing people's names without their permission. But it actually takes quite a bit of work to get those connections happening. And the reason that we look at that one-on-one is because open forums aren't for everybody. And to get the support you need sometimes from peers, some people need it in a bit more of a private way and in a way that they can feel comfortable. So, but that's the thing about working with humans. There's not one approach that suits everybody. Amanda.
Thanks, Kate. Again, this kind of flows into what you were just saying about it. Support groups are not for everyone. I'm just interested, have you had any men with scleroderma go through your program? Because we've done an online support group for men, and we have had not one single solitary male turn up. So I know they're a tough crowd, but, you know, we at the same time had, you know, anecdotal little notes and stuff that saying that it was a need. So we were like, right, okay, we'll put it together. And we've had, you know, for 5 months, 6 months, not one single solitary person turn up. So just interesting.
Yeah, no, we have had men through the service for sure. It's Scleroderma. Look, this isn't uncommon. So that people will say, yep, we want this service, that service, and the next, and you provide it, and they don't show up. So there's always that gap in what people want and what they're willing to show up with for. Look, and I think that's where you just got to start testing things out, like, you know, well, what's going to work for you? We've actually had, I can think of 2 men in the past, maybe 2-3 months, that have actually accessed men's shed instead. So
that's interesting, because the support group leader is from Men's Shed.
Okay, there you go. So look, and I guess this is the point of Pathways, is to understand, like, the more that you work with patients, the more you understand personality types and what's going to work for someone. And like with particularly with emotional and psychology and that kind of support, you know, we're taught when we're going through training, you know, it's counselling, it's psychologists, this is your referral pathway. But even that's not for everybody. Like that's actually not for everybody, that kind of formal support. So we have a part of the protocol that looks at emotional health, and that's looking at, okay, is a formal service something that this person would access? But it's also, is it something this person can afford? Because that's, you know, there's lots of out-of-pocket costs there too. But then we're looking at other things that you can do, and this is where the nurse-led interventions come in, talking to the patient, like things like journaling can help some people, mindfulness, meditation, exercise. There's a whole lot of things that you can do to help your emotional health that we can talk through, and it's not always formal. So that's the juggle. That's absolutely the juggle. And you're not alone. Like we're working with lots of patient groups that will say, oh, everyone wanted a support group, we put one up and no one came. It's like, yeah, that's humans. That's working with humans. Okay, we've got 10 minutes. Okay. Okay, so before I was talking about one of the best questions we ask is, what do you wish you knew? What do you wish you knew from the start? So that's, we've got 10 more minutes. So that's my last question, is to the group, is take a second, think back, one or two things that you wish someone had have told you earlier. I'm going to write them all down. Louise.
I can go, Kate. I don't even need to think about that. that everybody's journey is completely different, you know, with our condition. You know, we're all just so unique. We're like little unicorns, all of us, you know.
Yeah.
And the second thing I wish I had have known is that I am allowed to interview my clinician and my healthcare provider, and if they don't gel with me or they're not on the same page as me, that's okay to go somewhere else, you know. Yeah.
I agree. It's okay to get second opinions too. That's another one. Yeah, for sure. Anyone else? What do you wish someone had told you earlier, or you knew, or something that you've learned along the way that you think someone else might benefit from?
For me, knowing the benefits of the NDIS and the ability to access support on that score. Yep.
So I know with NDIS, some people struggle. Like some people get through, it's, you know, luck of the draw. And there's a couple of camps, and this happens in rare disease because it depends on who's looking at your case. With some people, it's like, no, we need a diagnosis. Without a diagnosis, I can't do anything for you. I don't know what to do. And then on the other side, some people have gone through and it's been like, well, I've got this diagnosis. I don't really know what to do with it. So it'd be better if we didn't. we didn't have that. Like it's a bit of a minefield.
Complicated.
Yeah, it's complicated, and it unfortunately the system is sometimes based on the human at the other end in front of you, not actually the process of the NDIS. One thing I will mention that I'm often doing in Pathways is we're not taking over the role of NDIS coordinators or NDIS at all. But what we can complement that with is, if I've talked to a patient and I've reviewed some of their reports and reviewed some of their tests and all this kind of stuff, I can then write a letter as well as support for NDIS to bring all of that into the context of scleroderma. So that the person reading the NDIS application can put it all together in their mind of why this is important, because sometimes it's absolutely missed. They're just looking at the function of the person and not why that's happening.
And I think, again, being considered an expert in healthcare, now having to become a self-expert in the disability sector, and it traditionally has been these two separate worlds. The fact that they need to be together is just so. And I see Amanda rolling her eyes too. Like, hello, but I think that's the biggest. That's the thing. Yeah,
it makes zero sense. It makes absolutely zero sense that these things are like disability health here. It's like we know a couple of advocates that are working, because there is change coming with NDIS. There's change that's been thrust upon us, but there's more change coming, and those two, well, it makes no sense for them not to connect. Okay. Did anyone else have anything you wanted to add?
There was just a question about getting in contact with you guys on this, but I'm sure you'll cover that when you finish up.
Yeah.
The other thing, Kate, can I just add one other thing? Would probably just try to link in with a scleroderma clinic. Not just go to your normal rheumatologist in your town. Try it even if it's only once a year, something like that.
Yeah, absolutely.
Because they have all the resources, your heart specialist, your lungs. The other thing is like I used to have all my tests done here, where I can have them done in Melbourne and don't cost me a cent. And I know that that one doctor will go through all the tests with the other specialists. So just trying to find a doctor that pulls everything together is worthwhile.
Yeah,
and don't go by what's on Google.
Yeah. Yeah. Well, we always look at what specialist people are seeing. And, if you're in the private setting and you've got one here, one there, but it's working for you, that's great. The ideal is getting into the centres of excellence, for sure, without a doubt. And that's where we would recommend people go if they're not already set up and not happy. It can take a bit longer in public in particular, but in the long run, it's absolutely worth it because of, as you described, that you've got more chance. It doesn't always happen, but you've got more chance of coordinated care. Absolutely, 100% for sure. So that's one of the big checklists when people are talking. I'm like, where are you at the moment? So we don't want to if people are happy and they've got good care and it's in the private, it might be a bit disjointed, but we're not going to disrupt that. We're not going to disrupt that if it's not something they need. But yeah, specialists, centres of excellence are a way to go, even for rural patients. And then we can look at shared care. So you might have your one or 2 days of appointments a year, but then how do we translate that back into your local setting as well?
The other thing is that you've got to know about patient transport and those sort of things.
And IPTAS and all of those kind of stuff.
Because no one tells you until, 2 years down the track.
Yeah, no, all those things. And why should you know? Like why should you know all of these things? That's what the health professionals train for and are meant to help to share. Chris.
I would have liked you to be my first contact when I was diagnosed. Someone said, okay, in your area there's this doctor, this dentist, this is the best place to start. It was a minefield, as I'm sure Rowena has found. You're sort of floundering around looking for people, and someone says, well, you've got to go to that person and that person. And it becomes so overwhelming. So having a pathway from the very beginning would have saved an enormous amount of heartache.
Yeah,
This is absolutely wonderful.
I hear that a lot, and you know, people that might have been diagnosed 20, 30 years ago, like,
exactly.
would have liked it. So that's actually something that I want to talk with Amanda and Tara about, is as a next step, we're doing more about outreach, and we've had some meetings with the partner organisations around outreach. One thing I think we really want to focus on with Scleroderma Australia and your partners and the specialist centre, the centres of excellence, are special referrals for newly diagnosed patients. Let's make sure that all the newly diagnosed patients come through. We get them on the right track from the start. You know, help them out that way. So that's something we'll talk to the gang about as a bit of a next step.
Awesome. Fantastic. That's fantastic.
And Amanda speaking here, and I don't know how many here are in the closed Facebook group. It'd be really great, you know, we post things within that group, but share your experiences. If you've done the telehealth Pathways Nurse, recommend to others, and actually just, you know, share your experience with them, and, you know, try and increase awareness at what the benefit is. I think it'd be really helpful for that community itself, because when it comes from us, you know, it seems to get bypassed in regards to, you know, we're trying to do our best to promote it and you know, sell it as something that it's a great benefit. But when it comes from directly from people that have used the service, I think it has much more weight and kudos. So I would really appreciate if anyone's that used it, just to share your experience and, you know, try and get other people on board for it.
Yes, I would totally agree with you, Amanda, because I have used the service personally, but still when I post about the benefits of the service, there's still a little bit of cynicism, maybe, oh, it's Tara from Scleroderma Australia, what's in it for her? So, there's care for everyone else, but other than that, that's, you know, so yeah, please share away.
Yeah, and we'll be able to. We're routinely doing feedback forms, so we can share those with you as well, and you can post away as well of people's comments that because it's been quite positive. Yeah. Well, I think our time's up. We're getting.
It absolutely is, and I know that you want to get back to bed, Kate. We honestly and sincerely do appreciate you getting up at a ridiculous hour in the morning.
You're very welcome.
Can we just mention the referral, please, Kate, if you can share how people access the service and how they get on board, please.
Yeah, I thought I had a slide on it. Let me see.
I could put it in the comments, just the link if you'd like.
Yeah.
Yeah, that'd be good.
Yeah.
Okay.
Hang on. Here we go. Just so happens that I have it in my bookmarks. Funny that.
So there's someone told me not to give my email away. It's too late. That's you got my email, the number you can call, and you can go to pathwaysnurse.org, and I'm pretty sure it's somewhere on the Scleroderma website as well.
Yeah.
Yeah. So, but as I said, we're starting to work quite closely with the different patient organisations to also collectively raise awareness, and even, you know, we're going to be writing to MPs and lots of general awareness so that people that need the service know it's there.
It's a brilliant service, and we're very lucky to be part of it. And you do amazing work, Kate, and we so appreciate your time today. And I know everyone's got a little smile on their face, so they've all taken away something brilliant.
Excellent.
Yes, and we just love we love the ethos of, you know, us empowering ourselves to move forward and take care of ourselves in the best way possible. So we appreciate everyone for coming and joining today, and all your feedback for Kate is brilliant. And if anything else pops in your head, I'm sure you'd be glad to receive an email, Kate, with any tips or tricks that we can think of.
Yep, for sure. Thanks, everyone.
Fantastic.
Thanks for having me.